We put together a quick conference call with the First Ministers today, and I want to just outline for you some of the issues that we discussed and the plans going forward. You will have been aware that last week the federal government announced a $1 billion package as a first step towards addressing the challenges of COVID-19, $500 million of which will be going to the provinces and territories for healthcare supplies and services. We have already made a fairly comprehensive list, working with health authorities, with the Public Health Office and others, the list of equipment and supplies that we will need going forward in the event of a surge of cases that we may anticipate in the days and weeks ahead. That's been transmitted to the federal government. Unlike many federal programs, I've had assurances from Deputy Prime Minister Freeland, from the Prime Minister, and again today on the conference call, that those resources will not be allocated on a per capita basis, as they often are, but instead on a needs-based account, as it were. And I'm grateful for that, and I think it's fairly self-evident. British Columbia has been at the front in terms of testing. We have a significant number of cases. Ontario, I believe, now has passed us in terms of cases identified, but keep in mind that they have almost 3 times the population of British Columbia. So when the federal government is dispersing those resources, they're going to be doing it on a needs-based basis, and I'm grateful for that. And the impact on employees, the impact on companies is our paramount importance after, of course, taking care of people's safety and their well-being, taking care of public healthcare providers, protecting those healthcare workers to the extent that we can, and broadly supporting our healthcare system. We also need to be mindful of the consequences to our economy. And so the bulk of the conversation, the bulk of the issues that I raised today with the Prime Minister focused on that, and how we wanted to ensure that the employment insurance program was as flexible as it could be to ensure we capture as many employees who are affected as is possible. There are a whole host of concerns that we have about whether we're putting in place the 14-day self-isolation period for citizens. We should also be ensuring we're doing that for travelers who come to British Columbia and Canada. And I think the federal government's already responded to that in large measure by restricting the number of points of entry in terms of airports that foreign travelers can enter Canada, and that the screening will be more intense at those jurisdictions and those areas than in the past. I did not get a commitment that Vancouver, YVR, would be one of those, but I expect, based on the volume of traffic through, that that will be an obvious choice. But again, I have every confidence that the Prime Minister, the Deputy Prime Minister, and the federal government were very receptive to the conversations they were having today with premiers across the country. Provinces deliver health services, and so it was comforting to hear the federal government recognizes and acknowledges that their role is to aid and assist us in the delivery of those services, and I'm grateful for that.